Two. Say to the righteous, it shall be well. It shall be well. And it is well. Afraid, he is the refuge and a strong tower. They shall eat the good of the land when the time is surely right. The Lord will never put his own to shame.
For they that trust in the Lord, they will never be afraid. He is the refuge and a strong tower. They shall eat the good of the land when the time is surely right. The Lord will never put his own to shame.
Say to the righteous,
say,
it is well with him.
It is well with
no matter what you're going through, it is well.
It is well.
Say to the righteous, it is well with him.
I should tell you
no matter what you're going through,
well with you.
It is well.
It is.
Say to the righteous, it is well with him. No matter what you're going through, it is well. Say to the righteous, it is well.
Hello, lovely people. Welcome to another edition of the Inside View. I guess you're all doing well, and all too soon. Today is the last Sunday of May. God has been so amazing to us, and we cannot take his praise for granted. If you're online and you're watching me, kindly do me this big favor. Share this link to as many people as you can. Let us support our men. Let us show some love. Yeah, I know this is a topic that a lot of people shy away from, but that is why we have, this the Inside View, to talk about topics that are so sensitive. But a lot of people, do not want to openly, admit and also, seek help. So tonight, the Inside View is so privileged to have an award-winning obstetrician and also gynaecologist, who has done amazing stuff both in Nigeria and also in the UK. And share this link, invite as many people as you can, invite, your families. Let's all sit down and, just educate ourselves. You might be saying, oh, I don't need this, but who knows, maybe in future, you might need this kind of information. So even if it's not for you, it might be for a loved one. So let us, come together tonight and, just help ourselves. Yes, so please do this favor for me. Share, like, follow the Inside View, and let's support ourselves. So tonight I have with me Professor Rotimi Jayesimi. Prof, welcome to the Inside View.
Lovely, good evening, and thank you for having me.
We are so blessed to have you, because in spite of your busy schedule, you always make time, to come and educate us. So we do not take your time for granted at all. So thank you once again.
You're welcome. Thank you.
Yeah. This topic is a bit, it's a no-go area as far as many men are concerned, but it's taken a lot of lives, and I thought, we should be, blunt about some of these things and not shy away from. So tonight we are talking about erectile dysfunction. And Doc, to start this conversation, why is this such a big deal that, some men will go far to take their lives when they lose the ability to, perform, or the ability to gain erection? One.
It's quite unfortunate that some men have to go to that extent of taking their lives when they are confronted with erectile dysfunction. I think it goes back to the expectation of the role of men or man. Men are supposed to go out and procreate with women, and you need the male organ to be able to do that. And when you're not able to do that, it can be viewed as if you are an incomplete man. And there's some stigma associated with that. It's not something people would want to talk about. It's not something people would want to discuss. So when the news gets out that, oh, that man is unable to perform, I think it brings shame. And it's that shame and perhaps not knowing where to go for help that can push them over the edge and going to the extreme of committing suicide. It's not common, but it does happen. And I must commend you for uh, bringing in this topic because it's something that we should discuss as men and as women should know about it because there are remedies for it. It's not the end of life when one suffers from erectile dysfunction.
Okay. And so, what is erectile dysfunction?
Well, I think the way I'm going to start or answer that question is first of all, what is erection? Erection, and I believe we've gone past the 8 o'clock watershed, so I probably will use biological terms.
Okay.
Erection is when the male organ, the penis, gets erect, it gets strong and stands. And what causes it? When a man sees a woman, the visual appearance of that woman can stimulate an interest in the man, a sexual interest, and you have blood flowing to the muscles of the penis. So it's that blood going to that area that causes engorgement of the muscles. And that's why the male organ becomes erect and strong and ready for action. And erectile dysfunction is when a man is not able to attain that kind of situation where the male organ gets rigid, strong, erect, and ready for penetration. So that is erectile dysfunction. Uh, at times, you can even extend the definition because there are men who will get that erection, but they are not able to sustain it for long. And then that's also an issue. That's another spectrum of erectile dysfunction. If you cannot maintain an erection for, say, more than a few seconds or perhaps a minute, that is erectile dysfunction. And it's because blood doesn't flow to the male organ.
So, what are some of the symptoms that men should actually look out for? In terms of this dysfunction.
I think from the name itself, it's straightforward. Is when a man cannot achieve or sustain an erection for sexual activity or intimacy between a man and a woman. So when a man is unable to do that, dysfunction means there's an abnormal function. Dysfunction is abnormal function. Erectile means it has to be erect. So when we say erectile dysfunction, we're saying there's a malfunction of the male organ getting erect, getting strong, getting rigid, and ready for sexual intimacy. So that's what erectile dysfunction is.
Yes. So, what are some of the physical and also psychological causes of this?
Yeah, the psychological causes. I mean, first of all, Stress, anxiety can cause erectile dysfunction. Age itself, as one gets older, it's commoner in older men. From the age of 40 going upwards, the prevalence of erectile dysfunction increases. There are also, apart from psychological issues such as stress, anxiety, depression, there are other causes of erectile dysfunction. And one of the other causes one can look at is there are lots of men who are on antihypertensives, that is blood pressure medication. There are certain blood pressure medication that can also cause erectile dysfunction. So we do also know that apart from medication, one's general health can also result in erectile dysfunction. If you are obese, you've got hypertension, you don't undertake exercise, all of these in their own little ways cumulatively can cause erectile dysfunction. So good health, good diet, exercise are things that people should do to try and reduce the incidence of erectile dysfunction occurring in them.
I'm so glad that you've mentioned about this, high blood pressure tablet, because I think that's an area that many men do not want to, take this medication, because sometimes they think, oh, once I start taking this medication, like in the long run, I might actually get impotent. So it's just preventing a lot of men from seeking help. So in this case, how can we make men, feel so open and also feel so free to talk about some of these issues without any, like being stigmatized? Because this particular topic or this area is affecting a lot of homes, it's affecting a lot of lives. So how can we make it more easy for men to see?
Yeah, I would say it's for us to talk about it as we are doing tonight. It's not something people talk about openly.
Yeah.
And it's something that if you are in a relationship, you should be open about it with your partner, who ideally and one would expect should be supportive of the problem that's going on. And knowing fully well that there is treatment or there are treatment for it. Again, that should help one understand. It's when we bury our head in the sand and don't want to talk about it, you don't want to share it with your partner, that it causes issues. And again, when there is strife in families, then the word gets out that, oh, that man cannot perform, oh, that man cannot perform. Uh, Maybe out of spite at times. Ideally, that should not happen in a loving relationship when erectile dysfunction is an issue. Both partners support one another. Uh, Before I digress, we mentioned the hypertensive drugs, blood pressure tablets. Not every blood pressure tablet causes erectile dysfunction. So it is something that one can discuss with their family doctor, their GP, their urologist or andrologist, or whatever doctor that's looking after you. Read the side effect. If it's something you don't like, they can give you alternative blood pressure tablets that will not cause erectile dysfunction. I mention this because if you fail to take your blood pressure tablets, your blood pressure is going to go high, then you can suffer from a stroke or you can even die from it. And when that happens, you're probably not going to even be able to perform at all. So, first of all, please look after your blood pressure, discuss your medication with your doctor. Even some antidepressants as well have been known to cause erectile dysfunction. So if that's an issue, discuss it. There are all alternatives on the market that your GP, your doctors can look into if whatever they give you is causing sexual problems.
Great. Let me just, just digress a little bit. in our community where we sell a lot of bitters, just to enhance, like men use them, just to enhance their performance. And what does this bitter do? Does it really help? Because like most of them, do over rely on these bitters, and as like as a form of aphrodisiac and other stuff. Is it really healthy for our men?
Yeah. I'm going to ask you a question. What age are you talking about? Are you talking of young men using these drugs, or are you talking about older men using these drugs? Let's try and have let's try and have a distinction between them.
Yeah, because I think at the moment we still have the youth, even still indulging in bitters, just to enhance their performance. So I don't have any age in the bracket, saying that maybe over the 40s or 50s, because now we still have a lot of young men in their 20s, taking bitters and other things to enhance their performance. So
a young man that is healthy, really, unless they have that is healthy, do not require any extra herbs or medication to increase their performance. Older men or people with medical conditions, may require some enhancements. And we've got to be very careful. Some of these herbs are effective, but the only problem we have is there haven't been any scientific studies to show their effectiveness, and secondly, to show that they're not harmful to the kidneys or to other organs in the human body. And I think one of the things we've got to be careful about is erectile dysfunction is not the same as performance. I think with social media now, men and perhaps their partners think that you've got to be able to go 30 minutes for you to be a man, or for people to say, oh, yes, you are a man and you haven't got any problem down below. But when you look at it, erection in men could just be 3 minutes. That's normal. 3 minutes sexual activity.
3 minutes.
Oh yeah, 3 minutes.
A lot of people will be laughing. 3 minutes. Oh wow.
No, I can tell you, yeah. I mean, it depends on maybe how long you've been waiting. But the maximum you'll get 30 minutes. And something you've got to realize about men is when orgasm happens, when you have, even if you don't have erectile dysfunction, once you have orgasm, the male organ goes into a rest phase where things calm down. And that's when the women complain that, oh, yeah, he does it and he just falls asleep. And that's because the blood goes to other areas in the body. And unless the man is stimulated, he may not get an erection again. He may fall asleep. But back to herbs, one has got to be careful that we do not abuse it just because of what we see or hear about on social media. I think, again, you've got to discuss with your partner. I could see you giggled when I said 3 minutes. There's no normal duration as to when coital activity takes place. Okay, let's extend that to 5 to 10 minutes. Perhaps most men and women will be happy if I say 10 minutes. Perhaps 3 minutes is too short, but 3 minutes is not abnormal. More so if it's not just once. I mean, you could do 3 minutes, go for a shower, start again, go into the living room, go into another room. You understand what I mean? Graphic,
Yeah, sure.
different positions. Then you wake up again and continue. So that 3 minutes could just be round one, and you may want to go as many rounds as you want to do.
Okay, so can this condition be hereditary?
I wouldn't say it can be hereditary. No, definitely no. unless one has got genetic conditions. Diabetes is hereditary, hypertension is hereditary. But if a parent, a father has got diabetes and the son hasn't got diabetes, let's say they've got diabetes and erectile dysfunction, and the son hasn't got obesity, hasn't got hypertension, hasn't got problems with the prostate, then they're not going to get it either. So it isn't hereditary. Uh, it's psychological. Uh, it's brought on by diseases. It's brought on by age as well, but definitely not hereditary. And again, nobody can put a curse on an individual not to be able to function.
Right. So, what are some of the risk factors?
You mean what predisposes to erectile dysfunction? I think first and foremost, uh, for men are very visual. You have to be attracted to the person. If there's no attraction, then you haven't got that libido. You haven't got the interest really, because you don't find the person attractive. And so, what's the point? So that's number one, the physical attraction. Then the loving relationship. Then again, the environment. If the environment is not conducive, I think we're stretching it a little bit, but it's part of what can cause sexual dysfunction, not just erectile. I mean, if you live in a place where there are so many people around, you may not be able to perform properly. And again, I'm going to bring in a medical aspect where erectile dysfunction can be an issue, and that has to do with fertility problems. If you've been trying for a family for, let's say, 5 years, and every month you are trying, your wife is saying, "Oh, darling, uh, this is my mid cycle, I'm about to ovulate, let's try for a baby." That pressure on the man thinks that, "Oh, I've got to perform." And because he's overthinking, rather than blood go to the male organ to make it rigid, the blood is going to the brain. And again, you have situations where such men can have problems with maintaining an erection because they're under a lot of pressure to perform. And that's why I say we shouldn't make sexual intimacy clinical. Just do it when you want, but not just, "Oh, darling, it's mid cycle. Can we make love now because we're trying for a baby?" It's a big problem, and that's the advice I will give to people trying for a baby. Don't make it clinical. Have sex 2 to 3 times a week.
So, I think I've got a question here. I mean, from all the way from America. And he goes, could erectile dysfunction be as a result of some women's, okay, could some erectile dysfunction be as a result of some women not presenting themselves attractive to the men?
Yeah, I think I made reference to that.
Yeah.
It's not the women not presenting themselves. I understand what he's saying. It's similar to what I said. If you don't find the woman attractive, then you're not interested. So if a woman doesn't present herself in a situation where they will be attractive to a man, then for that man, they're just not going to perform. But it doesn't mean for that particular man that it's a problem. It's just that the visual stimulation doesn't occur because the man is not interested. The libido is low. So that's one of the reasons. So, yeah, physical appearance, hygiene, all of those are very important in trying to make sure that the man is stimulated and is interested in you.
Wow. So aside that, what are some of the risk factors? Aside, the physical appearance, the environment, the hygiene aspect. What else?
Well, I'm going to try and go medical a little bit. Spinal injuries, have been known to cause erectile problems. If one has a spinal cord injury with weakness, maybe in the limbs, it depends on the level. One can have problems with erection. We've mentioned diabetes, we've mentioned hypertension. Another problem that can cause erectile dysfunction that men get worried about is prostate gland issue, either hypertrophy, when the prostate gland is enlarged, or when there's cancer and the prostate gland has to be removed. And during the process, the nerves are damaged, not damaged, they have to be removed because there are cancer cells there. And because of that, then men can have erectile problems following prostatic surgery, that is removal of the prostate gland. But it's not the end of the world, because um, what I said is that there are treatment options available, whether you have surgery, whether you have diabetes, or even whether you have spinal transection. There are treatment available for a man to be able to perform.
Great. Okay, so any complications? Because like you've mentioned, like any in case of accidents or like prostate cancers and stuff like that. What are some of the complications when somebody actually gets erectile dysfunction?
The complication, it's a problem, but you won't get complications from erectile dysfunction. The only problem is that you will not be able to perform sexually if it's not managed, if it's not treated. And there are over-the-counter medication available now that you can buy without a doctor's prescription, without mentioning names. There are drugs available that one can get. And if you do need surgical intervention, people can use penile implants, where you go to see this doctor, the urologist. They insert like a prosthesis, and when you want to make love, you pump it, and it makes the male organ stand, and then you're ready for intimacy. That's using penile implants. Again, you've got pumps. These are things that you will have to discuss with your partner prior to all of this happening, so that they are also very supportive. When you use pumps, what happens is the pump makes blood to flow into the male organ, and as soon as you achieve that erection, there's a ring that is placed at the base, at the beginning of where the penis starts from, and that maintains blood in the organ and makes it rigid for you to be able to do, to have sexual activity. So there's no side effect, or there's no risk, there's no complication. The only complication that I can say is it can destroy a marriage, or it can destroy a relationship, male to female relationship, or any other sexual relationship. If a partner cannot perform, then the other partner thinks, well, what am I doing with this guy? I probably have to go somewhere else. So it's more of a social construct or misconstruct that can be the fallout from this. And again, when you started, you did talk about a suicide. I think it can bring shame, it can bring depression onto the man, because they don't have the understanding of why they're in that situation. They don't have the understanding that you can seek treatment, or that treatment is available. And if you do get that treatment, then it is possible for you to reverse what's going on, and for you to be able to perform as a man.
Great. I think I've got another question here from Naomi Sunny. She goes, Prof, you mentioned age as a predisposing cause. At what age can this start?
There's no specific age, but I would say from the age of mid-50s going upwards, you will not be as strong, as active as you were when you were younger. But that's not to say when you see a 60-year-old man or a 70-year-old man that they cannot have erection. No, it's just that it may not be as it used to be when one was younger. So it's the older you get, the more likely that you will have some form of dysfunction. Not completely, but nowadays, even on the TV, you'll find it now. People are advertising all sorts of drugs, which are approved drugs to be used for situations such as this. So it is a known fact that with age, it's likely to happen. I would put the starting age from 50s, mid 50s onwards. But prior to that, if you're in good health, you should be able to achieve erection normally without any enhancers.
Great. You made mention of exercises. So, like apart from exercises, how can we prevent erectile dysfunction?
In terms of prevention, good health. One thing that we have all come to realize in wellness, mindfulness, wellness, well-being, if you look after your health right from when you're young, and that includes the diet you eat so you're not overweight, the food you eat, so you're not overweight, then exercise makes your muscles build up, you have strength, you have stamina, you have your heart works very well, cardiogenic exercises. So all of this come into the equation. We found out that people will even tell you that if you live well, if you undertake exercise, it reduces the chances of people getting cancer, different types of cancer. Uh, and just talking about what the question you asked, alcohol overuse will cause erectile dysfunction. Smoking can cause erectile dysfunction. Hard drugs, recreational drugs, if you abuse it, you're not going to be in a state of a mind to perform. So when we talk about what can cause erectile dysfunction, uh, smoking, alcohol, recreational drugs, hard drugs are contributory factors that can make a man not be able to perform adequately.
What about men who also overindulge in sex? Get
Overindulgence.
to the point, yeah, can they get to a point where they will not be able to perform again? Is there anything like that? I'm not too
I
sure.
haven't got that experience. I don't I don't think you can overindulge in sex. Um, I think once you are tired, you relax, then you recharge again. Perhaps what we are talking about might be people who are in the pornographic industry, where that's their action, and then they do all sorts of things, maybe to get jobs. When I say all sorts of things, you're now having people having penile enlargement, taking steroids, taking uh, enhancers as well. All of this really can affect one's ability to perform later on. But too much sex, you cannot quantify sex. So I think once your body's tired, you rest, you wake up the next morning, you're okay to start again. And don't forget that it's not just the man who gets tired. There's so much and so long a woman can tolerate a sexual activity. So when the woman says, "I'm tired, darling," then I mean, she's tired, and you cannot force issues. And that's why I said, when I said 3 to 5 minutes, maximum 30 minutes. But and again, you can do. Some people have sex 3 times a day, 3 times a week. It depends on individuals. So you cannot overindulge. There's nothing like oversexed person. Uh, if you have high testosterone levels, which that's the male hormone, yeah, you may be very active. but not to the detriment of your health, unless you've got cardiac problems and you collapse while trying to exert yourself sexually.
Okay, what about men who have a scar tissue? I learned I also could get the right word, but they have a scar tissue in their penis that I think eventually also gets them to have
Ye-
erectile dysfunction.
yes, yeah, that will cause a problem. People who have what we call priapism, and that is when blood flows to the penis. This can occur in people with sickle cell disease, and the blood stays in the penis for longer than it should. It remains hard. It damages the muscles. It scars the muscles. You have fibrosis of the muscles, and yes, that can cause erectile problems in sickle cell patients, in people who abuse these drugs. When you take Viagra or whatever it's called, and you mix it with herbs, and then you have a sustained erection that lasts for more than 3 hours or 4 hours, then you are in trouble. And then the only way you'll relieve that is if you go to a hospital, the emergency department, and what they usually do is they incise it to let the blood flow out. Now, if you do that recurrently, then you're going to develop fibrosis. The muscles, which should be elastic, will become fibrotic tissue. And when you get that, then it's going to be a problem. You're not going to be able to achieve an erection if there's fibrosis. So thank you for mentioning that.
So when men are going through this, this situation, what are some of the coping strategies that our partners can offer? Like if we for support, what can we do to support men who are going through such difficulty? Yeah.
I think first and foremost is to know, why is it happening? Let's assume it's due to diabetes. We all know what diabetes is, a high blood sugar. You've got to be able to support your partner to ensure that when they eat well, to ensure that the blood sugar levels are normal. If you have normal blood sugar levels, even though you have diabetes, then you're not likely to suffer from erectile dysfunction. There are some neuropathies that can also cause erectile dysfunction. So the role of the partner really, and you have to have an honest, open discussion within that relationship. Darling, dear, whatever pet name you have, I've got this issue. It's even nice if you're able to accompany your partner to see a doctor, so that when they're explaining things to him, you also understand what it's all about. And then when you know that there's treatment available, medication, surgery, implants, herbal medication, then you will know that this thing is still possible. Don't forget that sexual intimacy is done behind closed doors. So it's between you and your man or your woman. And when you are in a loving, understanding relationship, then there really shouldn't be a problem. So what I'm going to advocate is, talk to your partner about it. Have an open discussion about it, and be supportive of the person going through these issues. If you're not, then there will be issues. If you make fun of them, if you ridicule them, then there's going to be strife in the home. So I think a supporting, loving family or relationship is key to one of these things. And again, have a discussion with your physician, with your doctors. Again, men should be able to talk to men about these things. It's one thing we don't talk about as men, people. There are lots of men out there. We don't even know how many people have this problem. And that's because people don't come forward to complain about it. because they think people will laugh at them, ridicule them. So it's important we're open about it, knowing fully well that it can be managed effectively.
Right. So, in preparing, to go and see your doctor, your family physician, what are some of the things that men should do, for such appointments? What are some of the questions that they should prepare themselves, to ask the doctor? And also, what are some of the questions that they should also expect from their GP?
Right. When that problem happens, most men don't know why it is taking place, and it's the role of the doctor to explore what's going on. Is this psychosomatic or psychosexual? So that's where you explore the relationship between you and your partner. Is there any problem? Are there any financial issues? Are there stressors at work? Are there pressures of life that's affecting you? So the doctor explores that area. The man is not just going to come and see the doctor and say, "Oh, doctor, oh, I have this problem at work. I can't have sex, or I'm having difficulty with sex," because they may not link it. So for we doctors, we probe and find out. Then, for example, if you are on blood pressure tablets and you come to your doctor and say, "Doctor, I've noticed this new thing. I cannot perform well in bed," then you will have a medication review by your doctor, whether it's antidepressants, antipsychotic drugs, blood pressure medication, even some drugs that we use to treat prostate cancer can result in erectile dysfunction. So your doctor takes a full medical history, and it's upon that full medical history your doctor is able to say, "Well, we think what's going on is due to this medication, is due to your diabetes that is uncontrolled, is due to the fact that you've had prostate surgery, the nerves in the gland have been affected, and that's why you're having erectile dysfunction." And if you don't find anything, more so in elderly people, I think we've got to come to that realization as men that you cannot, at the age of 70, 75, be like a spring chicken. I mean, we age, and again, there are various ways of sexual intimacy, which we won't go into tonight, but it's just not penetration that's the issue. But it's an issue for some people, and that's why we are talking about it. Because if there's erectile dysfunction, it means one, you may not be able to penetrate, then you may not be able to have a sustained sexual intimacy. So it's important.
Great. So, what are some of the questions that men should actually ask doctors? Because I think this is, what you said is what maybe they should expect from the doctors. But what are some of the questions that they should ask?
Right.
Their doctors?
I think first, I would, for example, want to know what's normal. Because I'm going to say, if, for example, you said, "Look, I can't even get in, it doesn't stand. Because it doesn't stand, I can't even get it in," then the doctor is going to have to explore why that is happening. What's causing that? Okay. Now, if it's one such that, okay, I can get in, but within 2 minutes it's gone limp, then again, the doctor is going to have to explore why is this happening? What are the medical, are there any underlying medical conditions that we may not know about? What's your testosterone level? That's the hormone, that's the male hormone, testosterone. You may have to have that checked to make sure that you haven't got very low uh, testosterone level. And so basically, those are the questions: your diabetes, your hypertension, are there any endocrine problems, even libido. Libido is different from erectile dysfunction. Libido just means your interest in having sex. If your libido is low because your testosterone is low or because of other stressors of life, then you have to amend or alter those issues to be able to restore or revert the erectile dysfunction.
I'm still waiting for more questions to come in. So please don't feel shy or help one another. So if you have any questions that you want Professor Rotimi to help you with, please don't hesitate to send those questions across. Yeah, we all get to help ourselves. I think also soon we are coming to the end of our discussion, but in terms of support, I mean, you've made mention, but I think sometimes where there's no proper communication between couple, and also where the wife senses that this man has extra affairs outside, so maybe due to that, what can you say like in such situations?
Yeah, called communication.
Yeah.
Yeah, I didn't use the words particularly communication, but I said people to talk to one another, explain what's going on, and support your partner. So communication is important. Perhaps even lowering one's expectation. So the havoc social media is causing is a lot because people think you've got, you hear all sorts of words. What's his knack? What's what's your body count and all that kind of stuff. I mean, I never heard that until recently. So people think you've got to be able to say. And again, let me tell you something. I think some people probably over exaggerate what they can do to make them increase their street credibility. Oh, I can do it for 1 hour. Oh, I can do it for 45 minutes. Perhaps it's a lie. So, like I said, let's say 10, 15 minutes average. Yeah. If you can do it for longer, fair enough. 1 minute is too short.
I guess you were waiting for me to laugh.
Yeah, 1 minute is too short. But I think what I'll say is when the extramarital, you mentioned extramarital, that hasn't got to do with erectile dysfunction. The man who is going out, there must be a problem at home. And because there's a problem at home, whether it's appearance, like the question came up, whether it's discord, strife within the marriage, there's no more interest, there's no more love, the wife is not interested, the man is not interested, then it's nothing is going to happen, because that arousal, if you're not aroused, then you will not get an erection. So you need that arousal. So if there's that block of, oh, I don't love this woman anymore, I don't like her, I don't want anything to do with her, even when they wear all this sexy lingerie and stuff like that, nothing happens because there's that block, that psychological block is there. So I think a loving relationship is important for that, especially if there is no organic medical problem, if there's no stressors of life, if it's just within the family, then that is when you seek marriage counseling. Again, some of these things you may have to go to a marriage counselor. Earlier on, I mentioned psychotherapy. I mentioned sexual therapy, somebody who has an interest in sexology. And you may find out that just talking through it might improve things or might be very helpful. But it's something that we all have to talk about. It's out there, and we should have more of this program. And I think men should feel free to ask questions. We've had 2 questions, I think, today. Hopefully, perhaps you might get more after the program. I will be willing to address them. But it's a start. And I think they think erectile dysfunction is not a death sentence. It's amenable to treatment. If you try this, if it doesn't work, there are other forms of treatment that is available out there. And I think that's the reassuring thing, that it's amenable to treatment. So don't live alone with this hanging over your head or over the family or within the family. It's something that is we can rectify.
Great. We've had three questions so far tonight, and I've got one coming in also saying very informative. Yeah, so that's really, really, really nice as well. Also soon we've come to the end of our discussion, but I just want you to, personally talk to our women who sometimes find themselves in the situation, but and the men actually blocks them, like in trying to help and in seeking help.
Yeah.
What can you say to such women in trying to support or cope with this?
Yeah, I think what I would say is I'm going to take it from a context of somebody who, a couple that are in a marital relationship. It says for better, for worse, for richer, for poorer. When this kind of situation happens, communication, as Nana said, is very important. Empathy is very important. Not ridiculing your partner or your husband is essential. Understanding what the situation is, being a supportive wife or girlfriend or partner is very, very important. It is vital. When that support is not there, then it's going to be a big problem for that man. And when he doesn't get that support from within that environment, you might find out that he might want to go out and try and see if he can perform outside. And that's where you start having this discord, the breakdown in marriages. And like you said, well, I think you made reference to extramarital affairs. That's how it happens. But if it's within the family, you go to the doctors. I will advocate that you go and see the doctor together. So at least you also hear what the doctor's telling the man. You're hearing that, oh, yes, it can be treated. You're hearing that there's injections available, there are tablets available, there are surgical procedures available. So I think my plea to the man, be open about it. My plea to the women, communicate, be supportive of your partners when they find themselves in this kind of situation. And I don't know, I can't speak for elderly women in terms of, I don't know what 75-year-old men and women do. I've not got to that age yet. But I'm sure they have, like I said, it's not just about penetration. I doubt if you'll find a 75-year, 80-year-old man in a urology clinic saying they've got erectile dysfunction. I think the doctor will probably say, look after your heart first so that you don't die trying to impress. You've done it since God knows what age. You've done it for years. But I think the psychological issues have to be dealt with. I'm not saying 70-year-old men and 75 don't perform on women. What I'm saying is the older you get, it's the aging process. You will not be as active as you used to be when you were 20, when you were 30, or when you were in your 40s.
Great. So to the men who are actually going through this problem, but then they self-medicate, what do you say to them before we end this discussion?
We've got to be very careful with self-medication. And because it's over the counter now and you don't need a doctor's prescription, if you take the medication, if you haven't got an interest, if you haven't got the libido and you take the medication, you will not get an arousal, you will not get an erection. You have to be stimulated. You have to want to do it. But if you take it and you're not interested, your testosterone level is low, you don't like the woman, just swallowing the tablet is not going to make you have an erection. You still need that phase of arousal where, wow, I love this babe or wife or whatever, darling. If you don't have that phase of arousal, medication is not just going to make you go pang. No. And you've also got to be careful not to overdose yourself. Uh, Getting an erection doesn't mean if you take 4 tablets, then you're going to get a stronger erection. All of these medication have side effects. So you've got to be very careful that you do not take more than the stipulated dose. And again, do not mix tablets with herbs, because in the herbs, you've got similar chemicals that you've got. I will mention it by name: Viagra, Cialis, and all that kind of stuff. You have some of them in herbs. So if you're taking the tablets and then you're now taking some herbs that contain the active principle, then you are overdosing yourself and you can cause harm to your body. So that's the caution I will give to our men out there.
Thank you so much, Professor
You're
Rotimi.
welcome. Thanks a lot.
Thank you so much. We've been educated tonight, and also I just want to, just talk to our women when we see our partners going through this difficult situation. Can we offer our support, our sympathy, and also if there's anything that we need to work on ourselves on, then please let us do. Let us do. And also to the men who are also actually going through this unfortunate, situation. Don't shy. This is not the end of the world. We've been informed tonight that we have a lot of remedies. We have a lot of help available. You can visit your GP, who will direct you to your urologist. You can see other professionals who will be glad to support you with any help or should I say treatment. Like there's various treatments available now that can help with the situation. So don't suffer in silence, but seek help. And then to the men, let us now be open about our health issues. We shouldn't suffer in silence, and also we shouldn't self-medicate ourselves, because like in the long run, it might complicate issues. So let us be open. Let us be frank about our health, because we women, we talk about everything. Our symptoms and everything. We openly talk about them. Especially when we meet, and there's no shame around it. So please, let us be open about whatever we go through. If you don't feel comfortable actually talking about what you're going through with your fellow men, at least your wife, your girlfriend, or your partner. Yes. And also to the women, if the men tell us what we are going through, please let us not ridicule them. Let us be confidential. Let us have that respect for any information that they willingly or openly share with us, so that we can help them go through that period of difficulty. So let us support our men, and eventually it will come to our benefit. So once again, thank you, and let us all say like a big thank you to Professor Rotimi for this opportunity. So, Doctor, thank you.
It's a pleasure being with you, and I hope those listening would have had one or two things to take away. Just to say thank you to all of them for joining, and thank you. Have a good evening.
Thank you so much, and thank everyone that stayed on up till now. Thank you so much.